Hello everybody, Dr. Dvoskin here with Injury Doctors NYC. Wanted to talk to you today about illness that can affect patients after an injury, sometimes after surgery, something called complex regional pain syndrome. Other names in the past have been causalgia, reflex sympathetic dystrophy, and a few others. It's something on the more rare side that we see as pain physicians, but something that is crucial to evaluate early on and treat promptly so it does not progress to something much more discomforting, much more painful, or debilitating to the patient. So let's talk a little bit about what complex regional pain syndrome is. First of all, I want you to know there are two types. The difference between the two types is there a direct source of nerve injury that affects the symptoms. So for instance, if you had a motor vehicle accident that injured a specific nerve in your leg and now you're developing symptoms of pain, burning, swelling, or others that I'll go over, that may be more of a type 2 injury versus a type 1 occurs without specific nerve injury. So let's talk about what is complex regional pain syndrome. From the name, you could obviously tell it is a complex disorder, not very easy to pinpoint, may masquerade itself as other illnesses or diseases. So some common things are patients would present complaining of a burning sensation, possibly throbbing in an extremity. It does not affect the torso of the body. You can have swelling of the affected limb. You also may have shiny skin, changes in your nail bed growth. You may have changes in temperature or color. You may also have changes between a sweaty palm or a sweaty leg to all of a sudden being cold. Patients notice that sometimes with time their hair growth actually will change on the lower extremity or upper extremity that is affected. So as you see, there is a compilation of different symptoms that may at first seem unconnected to you, but proper physicians should be able to pick up on your symptoms and work towards diagnosing whether it is complex regional pain syndrome or another ailment. If, once again, it's not treated promptly, it will lead to further disability in most patients. It can even lead to muscle wasting, joint contractures where you form a lack of range of motion in that joint or extremity. You may also have chronic debilitating pain. So the question is, how do we diagnose complex regional pain syndrome? And there are predominantly clinical diagnosis, which means you talk to your provider and it's based on a set of criteria that includes signs and symptoms. To be specific, it's called the Budapest criteria, and that combined with a few imaging studies which help us rule out or rule in the diagnosis. Imaging studies your provider may order are a bone scan, sometimes simple x-rays, and a more advanced imaging study such as an MRI to determine if there's any specific explanation for the injury or whether it's the compilation of symptoms and complex regional pain syndrome, which is what you're suffering from. The treatment for the disorder, it starts with conservative treatment, including physical therapy, but unlike other disorders, it also tacks on certain treatments such as desensitization therapy or mirror therapy to improve the range of motion and improve the pain for the extremity. Biofeedback. We could also use electrical stimulation in the name of a TENS unit, transcutaneous electrical neurostimulation, and certain medications, of course. And these medications span from everything from a cream-based treatment, such as diclofenac cream, to compound creams potentially. Also medications such as traditional non-steroidal anti-inflammatories or steroids at the very early part of the disease to help decrease its impact. We also do have treatments that involve injections. Once we've evaluated and exhausted the conservative treatments, a sympathetic nerve block is commonly used, which can help decrease pain and diagnose the disorder. Finally, there are treatments with neurostimulation, such as a spinal cord stimulator, and now even more recently peripheral nerve stimulators, which have been implied to help with complex regional pain syndrome. So if you think that you've developed worsening pain, first of all, don't wait, get evaluated. And second of all, if you have any further questions, feel free to reach out to us at Injury Doctors NYC, whether it's via email or a phone call. Also, you can reach out to us on social media, whether it's Facebook, Instagram, or just comment below in this link.